I am Dr. Archan Garg. I am consultant physician at USTC Jain Charitable Hospital, Ludhiana, and also I am doing private practice in Ludhiana at my own clinic. Uh, our topic for today is understanding hypertension. So, how we have to diagnose it and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessels. This is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time, and if it is left untreated, it can lead to some serious health complications. In general, persistent increase in blood pressure higher than normal is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, and if a person is obese and his habit of drinking or smoking, and having some extra stress, all these factors lead to development of hypertension. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, their arteries can stiffen up and narrow as excess fat builds up. Also, family history of blood pressure is significant. If someone is having very close family member having hypertension, there are chances of having hypertension in that person also. Also, if a person is having excess salt intake, that is also a risk factor for developing of hypertension. Also, not having enough healthy food, particularly food rich in potassium. If person is not taking enough food like that, then that also increases the risk of hypertension. And also eating excess of junk food, fatty food also increases the chances of hypertension, and lack of physical exercise. And also if person is having like depending on the personality of the person is having more anxious and more anxiety and more stress, that also leads to increase in the blood pressure. Now, hypertension doesn't have an obvious sign and symptom. That's why it is called as silent killer. It puts people at risk of several diseases like cardiovascular problems, kidney problems, and also brain stroke, and also effect on the eyes leading to hypertensive retinopathy, and it can also cause sudden blindness also. So early and accurate diagnosis of hypertension is very important. So very simple method for this is to monitor blood pressure regularly, and consulting your doctor. Uh, Generally, when symptoms do occur, they are mainly morning headache or tiredness, vision changes, and buzzing in the ears, fatigue, or sometimes nausea or vomiting also. If person is having such symptoms, he or she should get blood pressure checked and consult a doctor. Uh, Fortunately, high blood pressure can be easily diagnosed. It is usually measured with instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Uh, a healthy or normal blood pressure should be lower than 120 by 80, where 120 is the systolic blood pressure and 80 is diastolic blood pressure. And systolic blood pressure means pressure in the blood vessel when the heart contracts, whereas the lower diastolic blood pressure indicates when the blood vessels pressure in the blood vessels when the heartbeat rests between the beat. So if a person is having blood pressure more than 140 or 90 millimeter of mercury, then the person is labeled as having hypertension. And on 17th of May, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing goal awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled if it is elevated. The risk can be prevented and by reducing the taking step towards a healthy lifestyle such as regular exercise and having healthy diet and stopping smoking and alcohol intake and regular blood pressure monitoring and stress management with the help of yoga or meditation, and also taking your medicine regularly and consulting your doctor regularly. So first is regular exercise or physical activity. Exercise can be a drug-free approach to the high blood pressure management. Regular physical activity makes person's heart stronger and healthy. And so if heart has to work less to pump, the force on the blood vessel will decrease and lower the blood pressure. In other case, we know that age and if the patient is obese, having excessive body weight, they are also risk factor for high BP. So we can prevent. Regular exercise helps to maintain our weight, and so our aim should be to do at least 30 minutes of aerobic exercise daily, most of the days of week. And also it can be high blood pressure can be reduced by regular jogging or swimming, any aerobic exercise. Then healthy diet, eating less of saturated fat and total fat, and taking more of vegetables, fruits, whole grains also helps in maintaining normal blood pressure. So dietary implementation is very important. So that will also decrease the need of medicine to be taken for control of hypertension. Having potassium rich diet like fruits and other juices also, their coconut water, all these are very rich in potassium and will help us in control of hypertension, and also reducing the intake of sodium in the diet, and so avoiding table salt and smoking and alcohol intake should be uh, decreased so we can control our blood pressure. Eating a DASH diet that is rich in whole grains, fruits, vegetables, low fat, dairy products also will help in decreasing the cholesterol levels, and they can help us in control of at least 11 mm of mercury of blood pressure. So you can see regular exercise and diet are very important in control of blood pressure, and that will help us to avoid medicine as far as possible. So even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by 5 to 6 mm of mercury if you are having high blood pressure. So we have to take low sodium food, and also we should avoid processed food that is very high in sodium. So we can decrease our sodium intake, and also we should not add any extra salt to the like any salad or dahi we eat in normal. So these helps in control of blood pressure. Also we should quit smoking. A person is a smoker, he or she should immediately stop smoking. That will also increase our chances of controlling blood pressure and also keep our health, our heart healthy. And then regular blood pressure monitoring is very important uh, by visiting doctor. Self monitoring also, it is always not possible for everyone to visit doctor if he or she is very like have some busy schedule in life. They can also do self monitoring at home and at different times, so and maintain a chart and then consult their doctor. uh, so that helps in better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure. So checking of blood pressure at different time is very important. Then stress management, we should everyone should learn how to relax and manage stress. That will improve our blood pressure control, like exercising, listening to music, or some doing yoga, meditation. All these things help, and pursuing any type of hobby. So that will help in reducing stress in the life, and that will help in control of blood pressure. Then the final thing is medicine. So if you a doctor prescribes you medicine for blood pressure, person should take it regularly and visit his or her doctor regularly. So I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life, and high blood pressure can be prevented as well as controlled in many ways, as already we have discussed. So that will prevent any further complications that are due to hypertension, like maybe cardiac problems, or related to kidneys, or related to brain, or related to eyes. So I will suggest everyone that everyone should be very particular about his health. So he or she should check her blood pressure or his blood pressure regularly. Whenever if there is any rise in blood pressure, that is, if it is more than 140/90, they should consult a doctor. And so already we have discussed, so we can try to control it with the exercise, with the healthy diet, and stress management. And if all these factors doesn't control blood pressure below normal, so we should consult a doctor and ask him to prescribe some medicine that helps in control of blood pressure. Thank you. Thank you, everyone.